Chances are you wouldn't be listening to this podcast if you didn't need to change your life and get healthier. So take action right now. Book a call with Dr. Ovadia's team. One small step in the right direction is all it takes to get started. Contact us at iFixHearts.com/talk. That's iFixHearts.com/talk.
Welcome, folks. It's the Stay Off My Operating Table podcast with Dr. Philip Ovadia. My best friend loves to listen to podcasts, and he tells me that you don't have to introduce it. I know it's a podcast. I clicked on it. So I'm keeping him in mind. Phil, we have a kind of a special guest today. They're all special, but this one's special in a different way. So I'm just going to turn it over to you.
Yeah, thanks, Jack. Really excited to introduce McKenna Duquette to our audience. McKenna, as we're going to get into, is a physician assistant. She's been in the medical system now for a bit, and she has joined the team here at iFixHearts and Ovadia Heart Health, and I think has a good background, a good story as to what has gotten her interested in metabolic health. And we're just excited to introduce her to our audience, and we're starting to integrate her into the team here. McKenna, welcome. And why don't you give a little bit of your background, maybe what got you into medicine in the first place?
Thank you for introducing me. So happy to be here. My story was I was exposed to medicine at a very young age. So I think I was blessed in that aspect of being kind of engulfed in the world and kind of knowing my direction pretty quickly. I was diagnosed with an autoimmune disease at the age of 4.
Wow.
It's rheumatoid arthritis is what I was diagnosed with then.
Oh my gosh, 4 years old.
Yeah, I think that was a little bit heartbreaking to my parents, of course, because they don't want their kids going through anything like that, especially so young. But so safe to say that medicine and me became friends very early in my life. Luckily for me, most of it when I was a child was a positive experience, but it definitely kind of led me into that world quickly. And I think people that had come along in my path during that time definitely gave me the kind of push towards the direction of medicine, kind of knowing that interested me, especially since it was something I was exposed to so quickly. And then I went off into PA school, and that took me towards ER and urgent care. So that's what I'm practicing now.
Yeah, and sometimes we like to give some peeks behind the curtain here into the medical world and the workings of the healthcare system. Some of our audience, I would say most of our audience has probably interacted with physician assistants, but may not really understand, what they are, what they do, what the educational process is to become a physician assistant. So why don't you go through that a little bit?
Absolutely. So physician assistant training is essentially a very sped up and dialed in med school. It was created to it was first created to make a position in the military that they could use to kind of rapid fire doctors through school to get them out in the field and practicing. In terms of how patients see us in an urgent care and an ER setting, it's fairly similar because when you're seeing a practitioner, you only see me. If your care needs to be escalated, then a doctor is brought on board, more particularly in the ER setting. But in urgent care and ER, we do operate autonomously. So I am the person that is the one who's kind of giving you the diagnoses, running the tests, giving you those results, and then coming up with a treatment plan from there. Obviously, we look a little different in different settings. We cannot perform surgery on our own. We can be first assists. And so that's the major difference is a doctor is super specialized in as you know, Dr. Ovadia, heart surgeries and everything. We obviously would not be the ones doing that. We'd be the ones assisting you in that. But in a more general practice, like a ER, urgent care, your internal medicine, your family medicine, you tend to be able to see just the PA to kind of take care of you throughout your treatment process.
Yeah, I think it's, become a very, important aspect of the medical system, that physician assistants can do a lot of what doctors do. And as you said, it's sort of a little bit of a sped up, or not, maybe not quite as brutal of an educational process. How long do people typically go to school to become physician assistants?
As a PA, you are in school for a full 27 months. There's not a break there. So you can't have a job while you're doing it at all, because you're Monday through Friday. And during your didactic year, which is your year of book work, you take 3 tests a week. And then when you're in your clinical year, which is where we go through rotations and we learn on hand training in the hospitals and whatnot, that is also full time. You're being assigned to a doctor, PA, nurse practitioner that you shadow, and that's a full 12 months of hands-on experience. So in total, it comes together for 27 months without a break.
Yeah, and physician assistants, they are in all areas of medicine. Like you said, their role might differ a little bit depending on what area of medicine they're in, but I can tell you there is always a physician assistant in the operating room with me when I'm doing heart surgery. And certainly many people will have gone to their family care doctors, their primary care doctors, and be seeing physician assistants as well. So what drew you to the emergency medicine field?
I guess a slight touch of adrenaline junkie. I think I just really enjoyed the fast pace of it all, and the fact that I had to use different parts of my brain throughout the day. It wasn't just the same specialty over and over again. So it kind of kept my medicine very broad spectrum, which was nice, especially when you're coming out of school. You're interested in figuring out all the zebras and nuances and putting it to use. And I think that was the main thing. I'm also someone who really loves to be hands-on, and getting the ability to close up those really ugly big wounds and suture them and whatnot. That was a big draw too.
And, how do you think your experience as a patient from a young age has kind of influenced, the way that you practice medicine?
Yeah, that's a great question. I would say, being someone who I had ups and downs throughout my medical care. Obviously, when you're someone who's been a patient since you're 4 years old, you have a lot of different experiences with different types of specialists. And there was definitely moments in my past medical history that I had very dangerous things happen where I had to be hospitalized and whatnot, not to get too into it. But I think it really lended a hand to making me hyper aware of bedside manner. I think that is massive in regards to patient care, being able to be empathetic and listen to people and absorb what they're saying, like truly listen. I think patients really appreciate that. And then just kind of being able to deliver information that's not so nice to hear in the best way possible for that person. So I think it definitely gave me practice in that, being exposed to it, seeing what I liked and didn't like.
I would like to know how, this is really a question for both of you.
Mhm.
Phil, why did you choose McKenna?
Well, yeah, I think, let's get into how McKenna became interested in metabolic health. And that's what kind of led to us connecting, and, me recognizing that she could be a valuable part of the mission that we're on here and the team that we're building to deliver that. I'm going to turn it to McKenna to ask how she, became interested in what we're very, I would say, upfront about on this podcast. This is not the standard of care. And, it takes a different way of thinking to do this in medicine. I'd love to hear from McKenna what led to her kind of opening her mind to this different way of doing things.
So, funnily enough, because I was someone who had a diagnosis at such a young age, at a very early time in my life, I would say it was pretty much around 16, that I decided that I wanted to take charge a little bit and look for alternative forms of medicine that weren't really talked about too often in a doctor's office. I remember when I brought it to my mom, she was like, "I don't know where you came from," because she's always called me her little hippie. But it was one of those things that I think I was just fed up with modern medicine not really working for me, and me being told, like, at one point in my life, I played competitive soccer all the way through college. And I did have a rheumatologist look at me and say, "You're not going to be able to play." And that absolutely, I'm type A semi-stubborn individual. That really didn't rub me the right way. And so I think I wanted to take matters into my own hands. Essentially, I felt like I was being counted out before I ever was given the chance. And at that time, it was back when acai and glucosamine and all that was just kind of being talked about just a little bit. And you could not even get acai in like freeze dried pill form. It was like this horrible fruit that was concentrated down and you had to take it from a wine bottle. And I remember taking it every day before high school and it just tasted horrible. But I wanted to change things. I wanted to pop off the medication. I was on methotrexate at the time. It's an immuno medication. It can cause your hair to fall out and lessen the immune system. And I just didn't want to have to deal with those things at that age. So we started with that. That's where I first started to dabble. And it was something, it like lit a fire because it was something that I was always interested in from then on. I remember at one point in college, I then sought out medical care from a holistic nutritionist. He kind of was leaned in a lot more to what we are calling functional medicine now. I'm sure that's what it was called then, but I just don't feel like it was in the forefront of social media has helped a lot with being able to expose us to that sort of practice. And I remember being gluten-free in college, which was a time to be doing that because at that time it was not a trend. So there was not gluten-free you could find gluten-free pretzels, but that was about it. So I kind of had to hone in my diet then. And I was always someone that was so disciplined based off of how things made me feel. And so I think it was just an interest that carried me all the way through life. Long-winded, but then I kind of stumbled upon functional medicine and what it is now, found a course that I really enjoy, started diving into it, still doing it. It's a lot of information. And as I said before, I'm a stubborn type A individual, so I want to be really good at what I do before I go out practicing it and passing that information along. And in that time period of exploring that, expanding upon it, surrounding myself with it, social media being a lot of the following functional medicine sort of entities and talking about it with colleagues who felt the same. One of my colleagues, he followed you on Twitter. I actually admittedly did not have a Twitter at the time. I don't have very many social media accounts. And he had told me that there was a doctor who definitely fell into the realm of what I'm interested in, metabolic health and kind of healing your body, getting away from the standard of care. And it was Dr. Ovadia. And he had made a post that he was looking for someone to add to his practice, to kind of help him expand his scope of care, to be able to access more people because he was getting busy. And so then I reached out and it kind of all went from there, making it onto the iFixHearts team. So long-winded answer, but it's been something that's been near and dear to me in terms of taking care of myself and accountability and breaking away from the minimal options modern day medicine sometimes gives you. And it just kind of led me down the path to find iFixHearts and Dr. Ovadia.
The acai, I don't know how to pronounce it.
Yeah. You know what? I don't know if I do it properly either, but acai is how I've always pronounced it. So I could be totally wrong.
What was the benefit for you? Did you actually experience a benefit? And if so, what was it?
So in terms of those medications, the major ones that I'm speaking to, the first three we really tried were omega-3s. Those are beneficial for multiple reasons, but in terms of like arthritic and joint pain, it's helpful for joint health, bringing down inflammation, whatnot. Glucosamine has the same sort of mechanism. Acai falls in there too. It's a really powerful antioxidant, kind of combats free radicals and things that cause inflammation. The main thing that we're focusing on is bringing down internal inflammation, which is lending to your autoimmune disease. Diet plays a massive part of that, but those supplements help to aid in that as well.
We've had an awful lot of folks on the show who have dealt with something like arthritis, rheumatoid arthritis, and have experienced tremendous benefit by going to a high protein, high fat, low carb diet. Is that something that as a child you were able to experience? Did you experience any kind of relief from symptoms?
So I will say in terms of when we started the natural supplements, it definitely made a difference. My main area where it started was in my right wrist. And so I have a lot of loss of mobility there just because it's been a chronic disease state area that's been affected by it for a long time. I tend to gauge it there. And it definitely did help when I started those supplements. When I was younger, I obviously hadn't dived into the whole diet situation. That wasn't really until college. But when I did go into college and I did start to become gluten-free, it definitely did help alleviate inflammation. But again, at that time, I don't know how in tune I was, because unfortunately in college, you're also drinking alcohol, which is inflammatory and whatnot.
Right.
So I don't think I was completely lending to it. But I will say now, I truly have been I had also been diagnosed with celiacs in my adulthood. It's not an autoimmune disease. Unfortunately, autoimmune diseases do tend to hold hands. Where one lurks, one's right around the corner. And so I was truly gluten-free for since 2 years ago. And it has absolutely made a massive difference, along with eliminating a lot of other inflammatory things that you consume in your diet. But yes, I would say absolutely, in terms of eliminating carbohydrates and focusing on high fat, high protein, it has made a very big difference in my own personal health.
What about, obviously, an elimination of pain or reduction of pain is huge,
Right.
but have there been any other, I guess we call them secondary benefits? And I'm thinking more maybe of non-physical things, mental or emotional, psychological benefits.
Right.
Anything you've noticed?
So in terms of 2 years of this, I will say a lot of them that you are going to register are going to be physical, right? Because they're just the things that you pay more attention to. I will
Yeah.
say I was someone that suffered with a lot of GI upset and bloating and whatnot, and that was definitely very difficult. I would say I definitely sleep better now. And when I fall asleep, I'm out. There's not many times that I wake up in the middle of the night. And I also will say that I do not get those afternoon slumps of being tired. Like my significant other will tell
Sure.
you, like, she does not sit down. It just powers through the day. And I will say that I don't get those slumps in the afternoon like I did when I did consume carbohydrates and was eating gluten.
I'm not somebody who has an autoimmune disease, at least that I know of, that I've ever been diagnosed with. And when I made the decision to stop eating vegetables that I didn't enjoy eating,
Mhm.
I'm not hardcore carnivore, but I don't know, probably around the time Phil and I hooked up, I had also just realized I don't like eating vegetables. And I didn't do it for this reason, but an immediate effect for me was the bloating that you talk about. I don't have that anymore. And it's really nice to not be uncomfortable. That's one of those things I don't hear folks talk about that much. But for me, it's just, oh, yeah, I'm not miserable after I eat. And it's really fun.
Oh yeah, it's something that you like people do take that for granted. Like I most meals was uncomfortable, especially before I became gluten-free completely. I was uncomfortable daily and it became my norm, and I'm so happy to be away from that norm and to be how I feel now. I'm definitely someone who really enjoys fruits and vegetables. I think I got that from my dad because my brother always called me a gerbil. Like I was always eating fruits and vegetables growing up. And so I still do enjoy those things. It's just finding the ones that you do and don't, and that do and don't agree with you. But it's crazy how much of an impact those little things have. And when you find it and you realize it because you've done an elimination diet, you stripped it back, maybe reset on carnivore, and maybe you just had a hard time just on carnivore, so you included like maybe a few fruits and vegetables. Like it's funny to see when you introduce new things back in how much of a knee-jerk reaction your body can have when it hasn't had it in a little while.
Yeah. You're the first young person that I've spoken with who's suffers from rheumatoid arthritis. So I'd like to ask some questions about that, specifically as it relates to being metabolically healthy. Our guest in our previous episode, Mimi Morgan, was diagnosed with rheumatoid arthritis around 60, and it was debilitating. And she found that a essentially carnivore diet reversed everything for her. At 70, she does things that people half her age would be thrilled to be able to do. But she didn't suffer from it, I guess, with the intensity that a lot of children do. The most famous RA sufferer I know was Michaela Peterson, who apparently had several joints replaced as a before she was 20. Have you suffered with to that extent?
So I do have a significant loss of mobility in my wrist because that's where it started. I do have there, it's called synovitis, but it's essentially when your joints do become a little bit deformed from the chronic inflammation there. And so I call it my pot belly finger, but my pointer finger has a pretty big knuckle and my middle knuckle, my PIP. But my wrist, it does not go nearly as far as my other one. I do have aches and pains in other places, but luckily, as I said, I think when you're diagnosed at such a young age, you don't know any different. So for me, when I wake up in the morning and I'm sore, it kind of is my baseline, which is a blessing and a curse, right? Because it's been something that's followed me through life, but I also don't know any differently. When I know differently is when it's really bothering me. Like on a day where it really hurts to turn the sink on, that's when I know I'm having a bad day. But other than that, because since I was 4, I was not someone who paid much attention to it. Like I was a very active kid. So I played soccer competitively at the same time as I played volleyball competitively. Certain times in those sports, those areas definitely hurt, more so in volleyball, obviously, with my wrist being the mainly affected area. But in terms of it slowing me down, it hasn't. And I hope it doesn't. Like I said, I'm pretty stubborn. So I don't know if I would kind of let it. But I will say that when it onsets for people later in life, I could see it being mentally difficult to handle because you realize that you are no longer at your baseline and your previous normal. And I think the reason why we see in Americans it onset, which is, sorry, I'm kind of veering, but I think we see it set on later in life because eventually our body gives up that tolerance, that bounce back for all the inflammation and inflammatory things that we're consuming. And for instance, gluten's inflammatory to every individual. You are not immune to it. Every human being is. And every day it causes transient leaky gut when you do consume it. And when that happens, we kind of cascade down an inflammatory pathway, and that can kind of lead to intolerance eventually. And then that can lead to autoimmune diseases and turn on those genes that were there in the body that were not turned on before, or at least not turned on enough to be recognized. And so I think that's why we see a lot of that autoimmune disease stuff kind of come on later in life. And I feel like that would be more difficult to handle than just suffering, knowing no different.
Any idea why you ended up with it?
You know what? No. So as a child, it's called idiopathic, as in they don't know. Sometimes you outgrow it. Most times children do. They thought I would outgrow it. But unfortunately, you typically would have after puberty. Mine did go into remission. And then I unfortunately suffered from something called nephrotic syndrome. It's essentially like a form of kidney failure. I was hospitalized then. And then after that, it flared again. So I'm not really sure what had brought that on. I had strep throat not too long before I had gotten nephrotic syndrome. So the rheumatologist, when my RA came out of remission, was suspicious that it was because of that big jolt of inflammation and the issues with my kidneys that kind of bounced it back. So some children outgrow it. A lot of them do. I just was not one of those.
How do you view RA and maybe autoimmune disease as broader topic now differently than maybe you did, experiencing it as a child and then, going through your education, maybe talk about what you sort of learned early on from your doctors or whatever about this disease, what you learned during your education about this disease, and how you now maybe view some things differently about this disease.
Yeah, I will say that there's definitely a decent amount of information that I've learned since starting my education with functional medicine. In terms of when I was younger, obviously not being versed in medical terminology and all that yet, it was more just, this is what you have, this is how we treat it. And a lot of times in modern day medicine, we follow a cascade, right? So like, you're positive for your rheumatoid factor, let's run these tests. Okay, this is where we start with medication. So you start with anti-inflammatories, and then if we want to get your immune system down, we start with a DMARD, and we're doing like methotrexate and all those things. So you kind of fall into a category. You learn it the same way in school in terms of when you're going through your course material. It's taught very similarly on how we practice levels and how to move on in medicines and whatnot. But every single disease state essentially is mentioned when you're in school, that lifestyle modifications should be tried first. They just don't really dive into what that means. And so I would say that since experimenting with things on my own, it's a lot of accountability on yourself, like monitoring the things you eat, what you do. There are things obviously out of our control, like we cannot control our genes, but we can definitely taper down or taper up which genes we're trying to get to activate or deactivate, right? In terms of everything that I've learned now and my view on it now, I will say, even from personal experience, controlling those factors that I have the ability to, what I eat, how I exercise, who I surround myself with in order to control stress, my lifestyle, holding myself accountable to keep those things in check have definitely made a massive difference in how I feel and in my health, when I did not necessarily focus on them at the beginning, when I was told, you have this, here is this medication, and kind of followed that route. So I will say it's been enlightening and it has been only beneficial.
I'd love you to kind of expand on that comment you made about being selective about who you surround yourself with and the stress that causes you.
Right.
That's not something that we hear a lot of on this show. I'd be interested to, why did you say that? What's that all about? And how does that manifest itself in your life?
Yeah. So I feel like a lot of times when we're focusing on stress, like when you ask someone about stress, their mind immediately goes to work or the things they have going on at home and whatnot. But I think in terms of relationships and the people that we choose to have around us, that also has a really large role in our brain chemistry, right? And it's as simple as being around people who fill your cup up, that you don't leave feeling drained after you've been around them, because that's going to take a toll on you. It doesn't end up making you feel better necessarily. And I also feel like that really plays into you surrounding yourself with like-minded people. So you're not constantly having to justify yourself and your practices and your ways. Like, I mean, that's why we formed a community on iFixHearts, for people to be able to kind of come together and have those same like-minded individuals to bounce ideas off of, talk about challenges. When you have people surrounding you that have the same goals in mind and also your best interest in mind, I think it's very undervalued, because you are no longer feeling like you're navigating on your own. You have a team of support around you. And so that innately is going to lessen that stress, better your mental health, and thus make your lifestyle a lot better too. Because stress, as we all know, plays a very big role in our health.
Well, Phil, it's got to be challenging for you. And because y'all are a team, I'd love to hear you talk more about being very careful about the people that you surround yourself with. I'm fortunate, I work for myself. The only people I'm with regularly are my beautiful wife sitting right there, and she's 100% on my team. I don't have to explain and justify why I choose to live the way I do. But the idea of having to do that, especially in a professional situation, it sounds like that could be extremely stressful.
Yeah, I mean, it's certainly a challenge when you're constantly, I would say, viewed as an outsider, viewed as the different one, when you're not going along with the program. And that's not an easy thing to do. And, one of the things that I certainly commend other clinicians, like McKenna, who have been able to, who have opened their minds to the possibility that we might be wrong about some stuff and start to do things differently. And I think, for the most part, that is stimulated by our, sort of desire to get better outcomes for our patients. And quite honestly, for a lot of people, a lot of the practitioners in the metabolic health space, it started with trying to get better outcomes for ourselves, right? Treat our own problems. And, having followed the advice of the system and seeing that it wasn't working, we start to seek different answers, and that oftentimes lead us down this pathway. For the people out there trying to do this, I do think it is very important to have a community that can support what you're trying to do. One of the things that I think is most predictive when new patients are coming into our practice, we usually ask them, what does your family, what does your spouse, what do they think about, these changes that you're trying to make or that you've been making? And probably, one of the greatest predictors of long-term success is having people around you that are supportive of this. And that's an impetus behind the community that we have established, at iFixHearts, that people can come and join and be around supportive people ultimately. I always think about that, the saying that, you're the average of, the 5 people that you spend the most time with. And I think it's very relevant. And I think it holds true when it comes to your health as well. And, even expanding upon what McKenna was saying about, choosing, your friends, to the extent that you can choose your family, I guess, if you're not, necessarily in a committed relationship, you're going to choose who you get into relationships with. But, just choosing who you spend time with, I think, is very important. And it's the stress part of it. And it's also the support part of it. And ultimately, finding people that are supportive is going to make your life a lot better than constantly being around people that are trying to bring you down or trying to tell you you're wrong about what you're doing.
Yeah, I guess so. Is there like is there a support community for RA sufferers? Is there, how do
Not
you do
that,
this?
Jack, I haven't really looked into that, if I'm being honest. I'm sure, like I said, I'm sure there's a Facebook group for everything, I feel like,
Yeah.
and I feel like that'd probably be a good place to start. But in terms of, for me, because I was introduced at such a young age, it was something that I just kind of motored along with. It wasn't.
When
Do
you
you
stumble onto somebody who also has rheumatoid arthritis, is there like this instant sense of deeper connection? And have you been able to share about the metabolic dietary things that help?
You know what? A friend's mom of mine, she was diagnosed with RA as a child as well. And she's actually gone through 2 knee replacements. She's in her 60s and she's an incredible human being. And she is tough as nails. And she has been someone who hasn't really let it affect her either, but she's definitely had a lot of those joint changes where she's then now needed surgical interventions because it's gotten far enough along. Obviously, even further back, there obviously was not a lot of resources talking about different metabolic ways to help your inflammation and your disease state. So now she absolutely does partake in that. And yes, it was very nice to come across someone who understood, right? Because there's not that many people that have had RA from when they were young. She was the only person I've ever met in my life that has. I think she found out when she was 7. And it was definitely, it felt like you found a needle in a haystack for sure. And it was nice to be able to openly communicate about it. But I think once again, both of us were diagnosed when we were so young. We don't think about it. But someone who was diagnosed later in life, that's now changed their world. And I empathize with those people because they lived normally and now they have to live a little bit differently, or not have to, but now they're
Yeah.
experiencing something that's forcing them to live a little bit differently. And so I feel like those are the people that would really benefit from a community to be able to talk to.
And, putting your sort of patient hat back on, what do you experience now when you go and see your doctors regarding this? And, how much do you talk about how these dietary and lifestyle changes have helped you? And, kind of what's their response to that?
Yeah, you know what? Despite being a practitioner, can be a bad patient. So I don't tend to make it to my appointment more often than I absolutely have to. But when I do go in there, I'm super transparent. I had gotten off of methotrexate when I was 16, and I did not get on another medication, and I'm still not on one. I had gone to a rheumatologist, and unfortunately, I had also suffered from melanoma, not to get too deep into my past medical history, but it obviously really limits what medications you can be put on when you need to dull down your immune system, but you're also not trying to make a melanoma or like the remnants of one worse. And so I was walking a really fine line there. And so for me, I was not feeling like I needed to be put on a prescription medication that could put me at risk of worsening like my chance of cancer when I was following a diet that was really helping me. But there's some practitioners that don't really want to hear that. So it was still, you are this disease state. This is the protocol. This is where you fall. You're moderate to severe. This is a medication we put you on. And I wasn't really budging from that. And I did end up seeking out a different clinician that was a specialist and is someone who's a lot more open about like me letting them know how I feel and whether or not I feel like I need to be on a prescription medication, because I'm a very active individual. I work out 5-6 times a week, a bunch of different types of exercise as well. And so for me, I don't feel like it's affecting me at this point to then add a medication to my body when I feel okay. And some people just don't handle that response well, and others are very open to the fact that you are not doing it out of defiance. You're more doing it out of what you've informed yourself on and how you felt throughout your own process.
I can see that. Wow.
Yeah, I think unfortunately, too commonly, practitioners do take it as sort of a challenge when the patient isn't listening to us, right? Isn't doing what we tell them to do. Unfortunately, the tendency is to kind of take that as a challenge and, maybe not pay attention to the results that they may be getting from that. And I just hope that continues to change. And, that certainly does not does not apply to all practitioners. But I see it more often than I certainly want to see it these days. Maybe then we'll wrap a little bit back to, you still practice in the urgent care setting. And so maybe talk about, how the new knowledge you've gained, the functional medicine and holistic approaches and dietary and lifestyle approaches, how you've been able to, integrate that into your urgent care practice.
So I will admit, in an urgent care, it is very much it's like a horrible way to say it, but it's more of a treat and street situation. Like I do not have the time to sit down with patients, especially when I'm seeing 40 to 50 of them every single day I'm in there. And so it makes that part a little bit difficult, right? Because you want to be able to sit down. Like I love teaching people about what I've grown so interested in, the things that have worked for me. But a lot of people are coming to me for smaller things that are meant to be talked about and fixed in that moment. So you coming in with an upper respiratory infection or pneumonia, and we're taking x-rays and we're figuring it out from there. I always try to give people the blurb of what natural things can help boost your immune system, focusing on your gut health being something that's really major to contributing to your immunity. Some people love to hear about it. I will say that the generation of the 30s to 40s are super open and into that. And I think social media plays a major part there. But in certain situations, I would say in that setting, it's difficult because it's a lot more limited in time, but also in what certain complaints are coming into me for. I would say that it plays most a part with people who are complaining of they can't get into their primary care. Where do they start? I've had noticed that a lot after COVID. It made it really difficult for patients to be able to get into their primary care. And so they're asking questions like, my blood pressure has been elevated. I cannot get into them. They're not changing my medication until I do. I don't have an appointment for 3 months. What do I do? And then having to really sit down with them and take the time to strip it back, despite having a whole waiting room of patients, but just giving them the tools to know what they can control on their end in order to try to better themselves prior to seeing the primary care. And then that's where the functional medicine and metabolic health education comes into play.
Yeah, I mean, and ultimately, the medical system and especially the urgent care system is not set up for these sort of lifestyle discussions and interventions, and so it is challenging. And obviously, that's what has led you to look for other ways of practicing. We are certainly fortunate to have you as part of our mission to make this type of care available to more people, and that really is the challenge. That care like this is difficult to find for many people. That's what we are working on.
And I'm really excited too, as well. Like 40 to 50 patients a day, like I said, does not give you the time to be able to sit down and really dive deep with people. And I'm really excited about being able to do that.
You have an advantage that an awful lot of the practitioners that we interview don't have. And it's the flip side of your disadvantage. Because you're seeing so many people, you have the opportunity to maybe draw conclusions about various cohorts of patients that you wouldn't be able to do with a smaller sample. You made a comment that I thought was interesting, and that's why I'm following up on this. You said people in their 30s and 40s. Can you make any generalizations about other cohorts?
So I will say,
and remember, you're talking to a marketer here, so that's what's driving my questions.
Yeah. So when I mean the 30s and 40-year-olds tend to be more receptive, they're the people who, because I mean, they're all on Instagram and whatnot, and the information is becoming more readily available to people, which is great. But they're more the ones to question me on, let's say they have a sinus infection. I'm explaining to them that there is no signs of a bacterial infection. So thus we don't want to use an antibiotic at this time because they come with their disadvantages, killing both good and bad bacteria, and they can mess with your gut health and whatnot. And they're a lot more open or apt to that. In terms of other
more open compared to,
I would say like the older generations, once you get into a lot of patients in their 70s, like when they come into me, they say, I have the sniffles and I want to nip it in the bud. It's like the most notorious statement that I hear on a daily basis, that they want their Z-Pak. It's been a day of the sniffles and their doctor always gave it to them and it's made it better. And so that's what they want. And you do go in circles explaining to them. And when they leave without it, they are very upset. And so that's a generalized cohort that is definitely there. The nip it in the bud statement is a widespread statement among a little bit older population.
Okay.
But yeah, I will say in terms of, you can definitely tell the people who have also done their deep dive on what they can control on their end, enlighten themselves on inflammatory things and beauty products and all that stuff, because those are the ones that tend to ask a lot more questions about the medications they're being prescribed, why they're being prescribed it, and which is great. I think that's so awesome because medicine illiteracy is very widespread. I really notice it a lot in the emergency department too, when you're serving patient populations that unfortunately don't have access to insurance. And so then they end up in the emergency department for their health care. Yeah. It's just health illiteracy becomes a lot more apparent there. And so I feel like it's wonderful for patients to start to advocate for themselves and ask those questions because it's only going to help them in the future.
Have you got any other general observations about generalizations of any kind of cohort that you can make?
That's a good question.
I realize that's a provocative question, but that could be really useful information.
Yeah. I would say that there's definitely certain patient populations that come in that are readily open to help themselves. And then there's ones that are absolutely not. So when it's hard to say who plays into that though, because it's not like a certain race, sex, age. You definitely, as a practitioner, I'm sure Dr. Ovadia could speak to this. He's going to have some of those people that end up in his office that are not going to make that diet change. You could tell them until blue in the face what kind of a difference it would make, but they're going to be the patient population that is the cohort that is like, nope, give me the medicine. I'm not giving up the famous cookies. It's not going to happen. I'm going to be a diabetic for life. Like, I'm just going to do insulin till my kidneys fail and I'm on dialysis. You just have a few of those patients that are just stubborn and they're not going to change the way that they live. And it's pretty quick that you're going to be able to tell that, but it doesn't lend to a specific, like I said, race,
Okay. All right.
sex, anything like that.
That was
Yeah, ultimately, the patient has to want to change. They have to be open to hearing this information and willing to put the work in. I mean, again, I think we're very transparent about this not being the easy approach necessarily, but it's the one that really pays dividends and in the end. And so if people are willing to consider that and then willing to put the work in themselves to do that, that's what we're here to support ultimately.
cool. This is fun. So I'm going to ask a question that we may have to edit out the answer to. How much of your work is as Phil's PA and how much of it is as whatever else it is that you're doing?
So right now I am full-time urgent care, PRN emergency department, and I also do some work with iFixHearts. Nothing in the PA capacity yet for iFixHearts. I have too many jobs at this point. But in terms of transitioning, like I had mentioned earlier, I am currently going through a course in functional medicine and learning that while working both those jobs. So it's been kind of like a slow and steady, I'm still doing that, growing closer to finishing. And so the plan with iFixHearts was, as you guys know, Lisa is now been brought on as another practitioner that patients can see in the Ovadia heart health realm. Once she was kind of up to speed and booked up, that then hopefully my next move was in that direction as well, to then be a practitioner that patients can see for metabolic health and functional medicine.
Oh, wow.
Yeah.
Wow. I'm sorry, Phil. I did not realize that is seriously cool.
Again, a little peek behind the curtain that Jack doesn't necessarily insight into what's going on in the medical practice, but the medical practice is growing. The demand is literally off the charts, and we're trying to grow to meet that demand. We look forward to having McKenna as a more integral part of the team. And honestly, by the time this podcast comes out, because there is a delay between when we record and when we release, she very well may already be there, but come look for her over at iFixHearts, and she's going to be bringing some not only just expanded capacity, but bring some unique practice aspects, some unique aspects to the practice, and we are looking forward to that.
Let's see. This one looks like probably first week of October. So if you're listening to this in October or later, and gosh, maybe McKenna's already doing that. Okay. I sound like a complete idiot because when it comes to the business side of the medical practice, I know absolutely nothing, but that may make me more qualified to ask the stupid questions. So that's what I'm here for. Okay. Are there any important questions that should have been asked that I haven't asked yet? And I'm asking both of you now.
I think you did a phenomenal job.
Yeah.
I think we covered it pretty well. Do you want to, I know you don't do a lot of social media, but do you want to drop any plugs or anything for people to follow you? We can do that and then edit that into the end of the episode if you want.
Oh, no. I mean, in terms of just to kind of expand upon, like once I do dive into the functional medicine, kind of making a few videos on my own, there's a Embry Health account that I haven't really gotten any posts up on yet, but that will be in the works as well. But other than that, no, it's Embry Health, and that's just on Instagram. It's MBRI Health.
Okay. I would not have guessed that.
Yeah.
All right. Very good. McKenna, it is a pleasure to meet you. I'm so glad you are part of Dr. Ovadia's team and obviously going to be a much more important part going forward. So that'll be cool. And I'm sure as a result, you and I will end up talking more than we would typically talk with our guests. Phil, Really cool. I love it.
Exciting stuff.
Okay. I'm going to ask, where are you
I am in St.
physically?
Petersburg, Florida. Dr. Ovadia and I actually don't live that far from each other,
Oh, my Lord.
ironically. Yeah.
Wow, that's even better. I'm
I know.
thinking it's going to be one of those. Okay. So that's cool. All
Nope,
right.
Florida girl born and raised.
Well, good.
Yeah.
It's
Okay.
quite unusual.
Yeah. We'll figure out how to build a thriving local practice one way or another. I'm a big fan of that kind of thing. All right. There's going to be some editing here. Yay.
Yeah.
All right. For McKenna Duquette and Dr. Philip Ovadia, this has been the Stay Off My Operating Table podcast. Thanks for joining us. Show notes, check them out, and join us next time. We'll see you.
Chances are you wouldn't be listening to this podcast if you didn't need to change your life and get healthier. So take action right now. Book a call with Dr. Ovadia's team. One small step in the right direction is all it takes to get started. Contact us at iFixHearts.com/talk. That's iFixHearts.com/talk.